Hello, everyone. Thank you for coming today. I'm very honored to be here. Thank you, Sue. Thank you very much. My name is Mitch Wolf. I'm a family physician at SSM, and I am married to this lovely lady in the purple over here, who you know very well, who asked me if I would kindly come and talk to you today. So we're not going to make it too long. I know you guys want to have some lunch, so I will not be offended if you need to go up and get a snack or a cookie or something like that. We're going to go over some topics, and then maybe hopefully we'll have some time for questions. And I'm going to hang around here, so my doctor hat is on if you have any questions. If you have any questions about rock and roll or anything like that, I can answer those too. Okay, so I was asked to talk about women's health. I'm very much a preventative medicine guy. I want to help people live long, healthy lives, not just long, but healthy and happy. So we're going to go over a few topics today. We're going to kind of break it into two segments here. One is going to be screening for disease, finding problems before there's problems. And then what we're going to do after that is we're going to talk about how to prevent disease in the first place. So we're going to go over some hot topics. We're not going to spend a ton of time on any of these because there's a lot going on here. Hopefully some of these discussions you've had with your doc. We're going to talk about cancer screening because that always seems to be the biggest one that people want to know about. We're going to talk about keeping your bones healthy. We're going to talk about the pros and cons of hormones. That's always a hot topic too. We're going to talk about vaccines because here we are in respiratory season. Everybody's coughing and snorting, and so vaccines are a hot topic. We're going to talk about people taking too many medications, which is a sensitive topic to me because it's something I see every day. We're going to talk a little bit about nutrition. We could spend the whole day on nutrition, but we're not going to. We're going to talk about activity and healthy skin, and then we're going to talk about maybe some not so exciting but important topics like advanced directives and that. So, again, I'm a preventive medicine guy. So if somebody comes into my office and says, "Why are you here?" I said, "Well, my wife told me to." I said, "Well, you need a checkup?" He goes, "Well, I don't know. I don't usually see the doctor. If it ain't broke, don't fix it." I show them the door. I call security on them. It's very important to me to have people take an investment in their own health. If you wait until your car is already broken before you get it fixed, you're in trouble. If you change the oil every few thousand miles, I love using the automotive analogy, your car's going to last long, the car being you, of course. So, in my business, we talk about screening tests. A screening test is a test that is done to find a disease before there's any symptoms. Now, the two primary ones that pop up are the two most life-saving things that we do in this business, which is mammogram, always a hot topic, and colonoscopy, okay? Numbers 1 and 2, I put that up there. That is a picture of a mammogram. I don't think you have to be a radiologist to find the problem here, which is up in the upper left there. That's trouble. All right, and then we'll talk about a little bit about colon cancer screening, but let's talk about mammogram first. It's a low dose, I stress, low dose X-ray that is done to find lumps and bumps before somebody feels a lump and a bump. And again, this is a life-saving test. Usually the recommendation is to start doing it somewhere between 35 and 40, about every 2 years between 40 and 50, and then annually thereafter. How long do we do it? Again, the usual stopping time is somewhere between 70 and 80. If someone is really healthy and I expect them to be reach 100 and they want to be proactive about their health, by all means keep doing it. If somebody says, I'm 79, I got a bunch of medical problems, I don't think it's going to affect my life, I will respect that as well. So it's not one size fits all, and that's the real answer here. If a mammogram is abnormal, the next thing that happens is usually an ultrasound for further evaluation and sometimes an MRI, but we won't go into too much depth about that. Colon cancer screening, I'm very passionate about. I lost my dad to colon cancer, and so I'm always getting on people to get that screening done. A colonoscopy is another example of a test that finds disease before there's disease. Again, thinking about being proactive. If you wait until you have stomach pains and you see blood in your poop, or the doctor says, "Ma'am, your blood count is dropping," you kind of missed the boat, okay? Colonoscopy is a wonderful test. It's not very appetizing to people. I understand the concerns. I've heard it all. I don't want to drink the stuff, all sort of stuff, I don't want them to put me to sleep. Basically what happens and I would almost bet that at least half the people in here have had one. I've had several. They knock you out and they clean you out, and then they take 20 minutes and look at your colon with a fiber optic scope, and if they see anything that's trouble, they can take a piece of it at that time. If they see a polyp, they pluck it out. you've essentially prevented colon cancer at that point once you've plucked out that polyp. And then you send it over to Dr. Jones, and he looks at it, he says it's good, it's bad, whatever. Then we decide when you need your next one, okay? If you absolutely don't want to have that, or you can't for whatever medical reason, and you don't want to be put to sleep, or your doctor says it's not good for your heart, there is a DNA test, which you've seen probably on TV, called the Cologuard. Saw the commercial with the dancing colon? Yeah, okay. It's a reasonable alternative. It's a DNA test, checks for polyps and cancers, but can't tell the difference. So if you do this test and they say it's positive, you're still going to have a colonoscopy. But it's a nice alternative, and it's way better than the old-fashioned just blood screening where they give you a little slide and you smear some poop and you send it in. That doesn't even tell the difference between something bad and a hemorrhoid. So we don't use that anymore, called Hemocult. So the Cologuard, if you're negative, you get a 3-year pass. If your colonoscopy is normal, you get a 10-year pass, unless you've had a polyp in your history or you have a first-generation relative that has colon cancer. Then you're on the 5-year plan, like me. Questions about that? I talk fast. My family's from New York, okay? So feel free to raise your hand. It's a small group. I see some familiar faces here, by the way. It's good to see y'all. All right, so let's get back over. Let's get to another screening. We're going to have a little interactive here. Anybody know who that is? That's Anthony Quinn. No, it's not. That's Anthony Quinn. He played Zorba the Greek, okay? This is the Greek physician. See what I did there? Dr. George Papanicolaou. Anybody know what he's famous for? Pap smear. There you go. He invented the Pap smear. So, the Pap smear has been a life-saving test. We simply don't lose women to cervical cancer anymore because we've been doing this test for the last 30, 40, 50 years. It's a very simple test where they just take some cells from those parts of the body there that we don't need to go into in too much detail, and they smear it on the slide and they look at it under the microscope, and they can look for precancerous changes. If it's normal, you get also a 3-year pass. The new Pap smear that is suspended in liquid instead of just smeared on a slide gives you a 3-year pass versus when most folks were having their Pap smears, it was probably a 1-year. So anyways, the technology has improved, and so if it's abnormal, then you're off to the gynecologist and they do whatever they need to do at that point. But again, ultimately what we're trying to do is find a problem before there's a problem. Early stages of cervical cancer can be found and treated with a number of techniques. So again, every 3 years for the norm is the norm on that. If we look at what's happened from the 1970s through the 1990s, I think you pretty well can see, you don't have to be a statistician to see the downward trend in every country that does this. And this is just a limited amount of data, but I think it makes the point. Okay? So, the next question is, do I need a Pap smear? Okay, here's another interactive. You ready for this? Who knows these guys? Who do we got there? Ike and that's Adlai Stevenson. If you voted for either of those guys, you don't need a Pap smear. I did the math, okay? Basically, what we're looking at is 65 is kind of the stopping point for cervical cancer screening, Pap smear in other words. Because if you look at the medical data, we just don't see a lot of effect on long-term lifespan. So at that point, we say 65, you've paid your dues. Unless you had an abnormal Pap smear in the past. Maybe you had hysterectomy for cervical cancer. If you get a new boyfriend, maybe we would consider doing that. Why? Because cervical cancer starts as a virus, the papillomavirus, which is a sexually transmitted infection. So that's why we're so aggressive about screening the younger women that are doing, what they do. And so it becomes less important as time goes by, especially if you've been with one person for a long time. So again, it's a judgment call, but basically 65, I usually use this term with women, you've paid your dues. All right, I heard somebody mentioning bones earlier, okay? Bone density screening, everybody's heard of the DEXA scan. It's another low-dose x-ray. It takes about 3 minutes, and what they do is they just do one swipe, catching your hips and your spine, and you can measure the bone density and lets you know what your risk is of a fracture, okay? Ultimately, what we're trying to prevent here is fractures, okay? Broken hips. Anybody here know anybody that's had a broken hip? Yeah, you have, right? Okay. Well, what happens? People fall and break a hip. No. the hip fractures and they fall to the ground, okay? So if people sit, I tell them you need a bone density test, and they go, well, I've never broken a bone, and I fell off, my bicycle when I was a kid. Okay, so we're looking at being proactive here, because if you wait until you've had a fracture, once again, you've waited too long. See how there's a common theme here. We usually start at 65. Yes, question?
I just wondered which kind of calcium you recommend.
A calcium packaged with vitamin D, oscal, caltrate, those are nice ratios. About 1,200 per day of calcium and 1,000 to 2,000 units of vitamin D. I will tell you, though, if you get one of those combo products off the shelf, you're probably not going to get enough vitamin D to be useful. So most people have to take an extra vitamin D.
But isn't there calcium carbonate and calcium citrate?
You'll hear all kinds of data on that. I think the point is get some,
Okay.
or eat lots of broccoli. How about that? That's good for you, too. Then you get the fiber. It goes back to that colon cancer story. So we start at 65, unless, again, there's always an unless, you have had an early fracture and they did an x-ray and they said, ma'am, your bones look kind of thin. You should have a DEXA scan, okay? If there's early osteoporosis in your family, if your grandma was looking like this by the time she was 55, I think we're going to start earlier on you, okay? So that's another reason. Or, if, for example, if you had early menopause for whatever reason in your 20s and 30s, that means you've gone a long time without estrogen in your system, you should have a bone density test, okay? Usually, we do them about every 2 years because it takes a long time for bone mass to change. Similarly, if we decide to put you on treatment, we're going to give it about 2 years to realize the improvement that you get from your meds to see if there's been any appreciable change. If we can keep you on the way up or steady, we're good. If it's on the way down, your doc's going to talk to you about treatments, which is beyond the scope of this. There's pills, there's shots. Most people have heard about them, but it can help maintain bone mass. I think the injections are probably the most state-of-the-art right now. But the most important thing doesn't involve any medicines or prescriptions or trips to the pharmacy. It's staying active. It's exercise. It's getting up and moving, fighting the effects of gravity, okay? Stressing the bones keeps them strong. If you're sitting around a lot, you're at risk. If you're up moving, you're taking that walk with the dog every day, that's wonderful, okay?
Wolf's Law, right?
I got a lot of them. Yes, that's right.
That's important there.
Exercise is good. We talked about calcium and vitamin D. Thank you for that little transition there. Smoking cessation, if it applies, basically tobacco use leaches the calcium out of the bones. But the risk factors are stuff that you can't change. If you're Caucasian, see a lot of Caucasians in the room. If you're female, if you're of thin build, okay? And then age, of course, is a factor too. So all of those factor into the decision to treat someone. So in the old days, they used to say, well, as soon as you hit menopause, we'll give you estrogen. Estrogen is great stuff. Keeps your bones strong, keeps your heart healthy. No, not so much. In the last 15 or 20 years, you've seen a lot of change in all the available information on estrogen. It's a mixed bag, okay? Will estrogen help treat the symptoms of menopause like hot flashes and vaginal dryness? Absolutely. And will it protect the bones? Possibly, but at what cost? You got to look at the increased risk of breast cancer. That's the big one, okay? So it's not, and maybe when you ladies were going through menopause, the normal was here. You take some Premarin, and that'll keep you healthy. That'll make up for what you're not making anymore. Nowadays, the strategy is we'll use estrogen to treat symptoms of menopause, but not the complications of it. We do not use estrogen to treat osteoporosis. Just a little informational point. I mentioned earlier, osteoporosis is thinning of the bones. The precursor of that is called osteopenia, if you ever heard of that term. I should have put that on there. Anyways, it's a continuum. So estrogen is for symptom relief, but it doesn't really prevent any diseases, okay? So that's, again, a personal decision. All right, so again, it's October 1st, 2nd, 3rd, 4th, whatever it is. Oh, it's the 4th. I know that, yes. Let's talk about vaccines to keep healthy, okay? There's tons of them out there. Sometimes it seems like all we want to do is just poke you with a needle, okay? The vaccines that are given because they're proven, and we've cut the death rates of a number of diseases. That's not even talking about the childhood ones. That's another whole topic. But what do we need in October? Flu shot, we're giving them now. We got tons of them. We got the pharmacies, got them. I got mine today, by the way, so I might need some Advil later. It's quick, it's easy, it's virtually painless. Flu can kill you, okay? Flu can be a fever and a cough and a headache, and you spend a few days in bed. It could also be influenza pneumonia. It can be life-threatening. So you will find that I'm a proponent of that. The viruses are smart. They mutate every year. They change their stripes every year, so we have to stay one step ahead of them by reformulating the vaccine every year. That's why you get it every year, okay? COVID. He has been a real pain for us for the last 5 years. Good news is we're not losing as many people as we used to. Why? Because a lot of people have had vaccines, a lot of people have been breathed on and had a mild case and maybe didn't even know it, and now there's sort of this immunity, it's what they call the herd immunity going on, where our population as a whole is not getting as sick and dying anymore, which is great. But this one also took a lesson from flu, and he mutates every year too. So what you're going to see now is that this COVID vaccine is going to be changing from season to season. It's not a booster, okay? It is reformulated. It is a new product based on what is happening in the clinics and the hospitals of this world. So that's available in the pharmacies. So many people are getting it now, we ran out of ours. Okay. Pneumococcal, that is the bacterial kind of pneumonia. We talked about viral pneumonia a minute ago, and there's another one coming. But pneumococcal is it can be a serious illness. And that's, there's a variety of different vaccines that have been available. You might have heard of Pneumovax, you might have heard of Prevnar. Right now, fortunately, there's one where you only have to have one anymore. So anybody here that needs their next pneumonia shot should be the last one you need. It's called Prevnar 20. And again, it protects up to 20 different kinds of bacterial pneumonia, which can be a serious and life-threatening illness. So your doctor stocks that in his office, most likely. Tetanus. Any gardeners here? Anybody like to work around the garden? Okay. What happens in the garden? Dirt and germs. Tetanus. I personally have never seen a case of tetanus because we start immunizing kids when they're babies and you don't see tetanus anymore. But in other countries, other parts of the world, absolutely. So that's every 10 years, even if there's no symptoms or anything like that. Shingles, another one I'm passionate about. Anybody's had shingles? Anybody known anybody that's had shingles? It's miserable, okay? It's painful, it's miserable. And if you're in that lucky few percentage, it causes pain for the rest of your life.
That's me.
Okay, we see it, and it's really rough on people, okay? But it's preventable, okay? So I'm going to talk for a few minutes on this one because I think it's important. We start giving the shingles vaccine at 50 because that's when you start to see somewhat of a takeoff on it. But shingles happens when you're either tired, stressed, or sick with something else, okay? That's when the varicella virus really pops up. So anyways, but you become more susceptible as you get older, okay? Your immune system is weakened. So that one should be, it's a series of 2, it's 3 months apart. As far as we know, you should not need another one, okay? If you had one in the mid-2010s, you know that there was one called Varivax, which they said, you'll just need one of these. Well, it was a live virus, and actually people got sick from it. The good news on this one is that it's a killed virus. It's just protein byproduct, so you can't get sick from it. But consider getting it. It's in the pharmacies. It'll give you a sore arm, no doubt, but it's better than having shingles. You agree?
I agree.
Okay.
I had shingles in my 40s.
Yikes. All right, and the last one I'm going to talk about is another one that you've probably seen on TV during the evening news called RSV, respiratory syncytial virus. That is a virus that also causes pneumonia. Yes, it's the same RSV that causes sickness in babies, okay? But RSV also causes pneumonia in older adults, and it can be severe, and it is one easy shot at your pharmacy. All right, that's 6 shots. That's probably enough for one day, isn't it? Yeah. Okay. All right. It is available, okay? This one came out over a year ago. It's been stocked in the pharmacies. We don't stock that in the clinic, but everybody has it. So all you do is ask your pharmacist. Any questions? All right. I'm not going to ask anybody here how many prescriptions you take because the fact is in modern medicine, the older you are, the more pills you take, okay? And they told us a long time ago, and I still found it to be true, imagine that you take one drug for every decade of your life, okay? See that picture there? It's maybe a little bit over dramatization, but I certainly see people with that many pill bottles come in and say, I don't know what's going on. Can you help me with this? I want to take less pills. So you spread them out on the exam table, and you find out they're taking 3 versions of the same drug from 3 different doctors that are not talking to each other every day, okay? You take, the more medications you take, the more chance of side effects. Every drug has a side effect. The more chance of drug interactions. These are chemicals, they're poisons, they interact with each other. You take this drug, the level of the other stuff in your bloodstream goes up, or vice versa, it goes down, and now it's not working as well, or now you're toxic on it. It's a constant moving target. But when I tell people bring a bag, and they do, they bring a bag from the grocery store and they put it out on the table, and we start going, oh my God, no, we don't need that, and I'll put an X on it and turn it upside down just for drama. Don't take that anymore. And hopefully we weed out some of the meds and we cut down on the amount that they're taking, but people spend so much time going to the pharmacy. And the last thing I put on there is chain reaction. It's exactly what you think of. Doc gives you a drug for some little problem and you take it and it causes some kind of side effects, so they give you another drug to treat the side effects. That one has its own side effects, and then the other doctor who's on the other side of town, who's your specialist, he gives you something to treat those side effects. This happens a lot, and that's how you get that big collection that's on the table. So that's a perfect transition to how to stay away from too many medications. It's all about food. Food is the best medicine. You told me that years ago. Actually, Hippocrates said that 5,000 years ago, but he's retired now. So I'm only going to put up one slide because we could talk about nutrition all day, but the bottom line is have you seen the plate with the dividers on it? Okay? What's going on here is, in general, about half of your plate should come from stuff that grows in the ground. Produce, fresh fruits and vegetables, colorful produce that's full of nutrients that your body needs to fuel its metabolism. Okay? You get over here to the carbohydrates, a big part of the American diet, right? Bread, potatoes, rice, pasta, bagels, tortillas. Did I cover every ethnic group? Okay, good. But that's white, fluffy carbs. Not all carbs are created equal. For example, what do they got here? They got some brown rice. They got whole grains. They got whole wheat pasta. They got whole grain breads, okay? That should be about 25% of what you take in for each meal. Then in the upper right there is your 25% of protein. Not all protein is created equal, okay? There's a big difference between the burger portion of a Big Mac and some lean steak and some salmon and some beans and some lentils and some nuts and some tofu and some big grains there that look pretty healthy. I don't know what it's called, but they look healthy. So not all food is created equal. So the best thing you can do is work toward incorporating more of the stuff from the produce section of the grocery store into your diet, as far as what's happening in the stuff that's on the shelves that's packaged in plastic and has a big label on it with 50 different ingredients that you can't even pronounce. Okay? Eat the rainbow. Thank you. What's that?
Raw or cooked?
Go for it. Whatever. Whatever. It's better than not having it. Don't cook it till it's mushy. But if you eat it raw, you're going to get a little bit more of the fiber, but you're still going to get the nutrients. All right. I think we're doing pretty good here. Let's see what else we got here. Let's talk about activity.
What about frozen or fresh?
Either way, as long as you're getting something that started out in the ground, that's a whole food. You know what a whole food is? A whole food is a food that has one ingredient. You can hold it in your hand and you know what it is. It's an apple, it's a pear, it's a peach, it's October, it's a pumpkin, okay? I'm not convinced pumpkins are edible, but that's another whole story. But you don't need a label to tell you what's in it. But you go to the grocery aisle and pick up the package of Chips Ahoy in the blue package, and then you see what's in that. I'm like, that's not a whole food. That's what we call a processed food. So big difference. But fresh, frozen, cooked, raw, get some stuff that started out in the garden. Okay? All right. Activity, huge. Okay? I see this every day, and it drives me nuts how, as time goes by, particularly after retirement, I got to say, people just kind of stop doing stuff. and that includes activity, okay? This is fall, it's beautiful here. It's not like this all year round, but today's a good day for a walk. So one of the things that happens, and you'll hear this a lot from your doctor, oh yeah, what you just told me, that's just normal aging. It's just, you're just getting older. And that dismisses a lot of complaints. But one of the things that there's no dispute about, no debate, is that you lose muscle mass as you get older, okay? Now, what does that mean? That means maybe you have to buy different clothes. No. What's going on is your body's changing, okay? Metabolism happens only in muscle, not fatty tissue, okay? You lose muscle, your metabolism slows down. You're not burning as many calories. So then you do store the weight here in your midsection because you're not burning enough calories. So part of healthy activity is not only walking like these ladies are doing here in the park and getting the heart moving, and they're also, what else are they doing? They're talking to each other. They have social interaction. They're getting fresh air. There's more to this than just a walk. But anyways, walking is good, gets the heart rate up, keeps your heart healthy. But if you really want to maintain mass, go get yourself a couple, 3 pounds of weights or more. Do some weights. You got to maintain the muscle mass. Do some squats. Okay? Because what else happens when you lose muscle mass? Your muscles get weak. And then what happens? You fall. You fall, and maybe you do break a hip or your head or something like that. And I see this like every day, so that's why I kind of feel comfortable talking about this. That's a disaster, okay? You fall, you break a bone. Doctor gives you some pain medicine. Pain medication makes you drowsy. You fall and break another bone. He says, well, we shouldn't use narcotics. We'll use non-narcotics. So we'll give you some anti-inflammatories. And then your kidneys get affected. And then you have to go see the kidney doctor. There's that chain reaction again. So staying active and keeping your muscle mass is important. How do we build muscle? Let's go back to the slide. The protein, I showed that to you already, okay? A good intake of lean protein plus the activity program to incorporate that protein into your muscles, keeps your metabolism up, keeps you strong, keeps you off the ground where your family has to pick you up. All right. I think we're almost there. We're doing good. Okay, so skin cancer, certainly something, it just seems to be on the rise. I'm going to blow up this little picture here in a minute so you can see it better. But basically, people come in with skin lesions all the time from could be sun exposure 20 and 30 years ago. Sometimes skin conditions run in family. About 1 in 5 people will have some sort of a skin cancer in their life. Again, people with the palest skin, Caucasians, that don't have as much natural protection from the sun, the melanin, that dark pigment that makes people with dark skin dark, and vice versa, puts you at risk of the UV from the sun. If you're a redhead or a blonde, got any blondes in the room? Okay. Or if you're freckle-easy, your skin is susceptible to UV damage from the sun, okay? But melanoma, that's the bad one. That can kill you, okay? Skin cancers are not all created equal. There's the ones that are caused by the sun, and they're irritated, and they rub on your clothing, and we take them off, and you're fine. Melanoma is the bad one. That's the one that can spread, okay? I found a stat when I was putting this together that worldwide, there's 1 death per hour from melanoma. So you may think of this as just a spot on the skin. No, it's not. It's happening internally in you, okay? So I'm going to just give you this little strategy to remember in your mind. A, B, C, D, E, okay? The A, B, C, D, E's of skin cancer. A is for asymmetrical. Something is symmetrical, you draw a line through it, it's the same on both sides, okay? As opposed to this one here, you cannot draw a line through that and get it the same on both sides. It's asymmetrical, it's weird shaped, it should be off you, okay? B is for border. You can clearly see where the red stops and the skin begins on B there, okay? This one here, you can. It's kind of irregular and also indistinct, and you don't know where the lesion stops and the skin begins. That's B for border. That one should be suspicious. C for color. If it's the same color all the way through, that's probably okay. That one it's fairly round, has a sharp border. Not too much worried about this one. This one's got some brown, some light brown, some dark brown. Sometimes we see some purple, some blue. It's bleeding. That one needs to come off. Diameter, 1/4 inch, otherwise known as a pencil eraser. That's right. That's 6 millimeters, but we're Americans. We don't do millimeters. So 1/4 inch, same thing. If it's that large, it needs the attention of your physician. And then finally, evolving. In other words, changing. This has been present for a while, Doc, but it's getting darker, it's getting bigger, it bled, that needs to come off. Okay, so A, B, C, D, E, a quick and dirty way to look in the mirror or have a loved one look at you and say, that one needs to be checked. Okay, so that's all the fun stuff. Let's wrap up with something that's not too enjoyable, but also important. Living will, advance directive. I am going to put you on the spot here. Raise your hand if you have an advance directive. If you have one. If you have a trust, it's in there. Advance directive, pretty much the same as a living will. That is that document that you have that says what you would say if you could talk in the hospital. But if you're not able to make medical decisions, if you're sick, if you're on a ventilator, if you are not expected to make it, now is the time to make your wishes known, whatever they are. Do nothing, do everything, and all in between. Okay, there's a lot of slots there that you can sign. Don't want to be on a breathing machine. I don't want to have CPR. Whatever your wishes are, the time to do it is now when you're at your best. And put it in black and white and have it witnessed. You do not need to have it notarized. You do not need a lawyer for this. You can get it online. Just type in Oklahoma Living Will and it'll come up. Review it with your family, sign it, have it witnessed, send it to your doc so he can scan it into your chart, he or she, sorry, into your chart, make it part of your medical record. That way, if the unforeseen awful thing happens, we want to know what Aunt Sally would have wanted, okay? She may have had this discussion with you, the family over the table after a couple of sherries, you know? I don't want to be kept alive. But here is your chance to make your wishes known, okay? So I kind of feel passionate about that as well. I threw in a little thing about a DNR, okay? DNR means do not resuscitate. That means under no circumstances would I ever want to have CPR, would I ever want to be put on a breathing machine. Even if it's just something temporary like pneumonia, they could probably save me. I don't ever want that. That's DNR. That means that if something happens and you've checked out, they're not going to save you, okay? That's as opposed to the living will, which says if I have an irreversible condition or I'm not expected to make it. Some people, for whatever reasons, religious, ethical, family upbringing, say, you do everything no matter what, even if you can't save me. I have people do that. People say, if you can't save me, let me go. People like that. And again, everything in between. So get that document, give it to your doc, and that's quick and dirty. I'm going to put this up here because I really appreciate your time and I appreciate you listening to me babble for a little while. I'm going to hang out here because I want some food too. But do we have any quick questions for right now?
You've covered so much.
Speechless. You're speechless. Okay, thank you.